Hello everyone, and thank you so much for tuning in today and joining us for our next episode of Ask the Insider, inside Sesame Allergy, live from the Quad AI. I'm your host, otherwise known as the Insider today, Gary Falcetano. I've been a licensed PA, physician assistant associate for over 25 years with extensive experience in emergency medicine, primary care, and for the last 11 years, allergy and immunology. I'm currently the Scientific Affairs Manager for Allergy for Thermo Fisher Scientific. And in that role, it's really a great role because I get to not only speak with and educate allergists and specialists and primary care clinicians around the country, but I get to work with some of the leading researchers that are advancing advancing the state of the art of managing allergic disease. And one of those researchers is actually my colleague, who I'll be introducing in just a minute, and we're lucky enough to have her joining me today to talk about food allergy in general and sesame allergy specifically. So, who you won't see on the screen today is Becky. She's behind the camera. Becky's going to be making sure everything goes right. She's also going to be monitoring the comments. Please put any questions you may have in the comments, and we'll hopefully get to as many as we can when we're done with the body of the program. So, as I mentioned, today we're going live from the Quad AI, otherwise known as the American Academy of Allergy, Asthma, and Immunology. We're at their annual meeting in beautiful downtown San Antonio, Texas. And thank you for the hearts. It looks like we're getting lots of hearts. I'm joined here, as I mentioned, by my colleague, Eva Sodergren. Eva, would you please kind of tell us a little bit about yourself?
Yes, I'm so glad that I was invited to this Allergy Insider on Sesame. And I'm a nutritionist by training and did my PhD in clinical nutrition. And I've been, like half of my work life, I've been working with allergy and especially food allergy. And now I'm a scientific advisor and a manager for the scientific affairs and education teams from EU and international. And I'm from Sweden, so I've also been working actually at the Swedish Food Agency. And
what is the Swedish Food Agency? Can you explain that to us?
It's like the food part of FDA.
Ah, okay. All right, so a governmental
body, agency, and really responsible for food questions for Sweden.
Well, great.
And so, but there I worked mostly with food allergen labeling questions and issues. So I really, I have a passion for food allergy. That's
fantastic. It looks like we've got the right person in the chair next to me today. So let's get started. Yeah. And I think first let's talk about kind of prevalence, right? Of how common is food allergy and in particular sesame allergy, because that's what we're going to be talking about today. But I think it's becoming more prevalent, correct?
Yeah, that's true. Food allergy is increasing worldwide, and we don't know exactly for sure why this is. It's speculations and hypotheses, but we believe it's really lifestyle changes, and also dietary changes that are really behind this.
So people are eating a more diverse types of food, so they're being exposed to different types of food.
Exactly.
Right.
So new foods and exposure is sort of really that's where allergy starts. So, and you have a lot of food trends, and you import different kind of food cultures from. So it's really global food. Also have a backside. It's like
sure. More and more people are eating foods they were never exposed to before.
Exactly.
Yeah. And then you also kind of talked about lifestyle, but lifestyle is also kind of how we've evolved, right? As a population.
Yeah.
Our microbiome changes depending on what we put into the body and what we're exposed to as far as different microbes.
Yeah.
And
also hygiene. There is a hygiene hypothesis that we're living a much more cleaner life now, and that is also we don't train the immune system.
Yes, we're not challenging it the way we did in the past.
No, exactly.
So, do you know, we're talked about increasing prevalence. What is the prevalence, do you know, in the U.S. of sesame allergy?
So it's about one. Now I can't remember exactly the number. You talked about it.
I believe it's a little over 1 million.
Right? 1.1 million. But it's difficult because the prevalence studies for sesame, we need more of them basically, and many of them are self-reported. So, but
and it can be a bit of a difficult diagnosis, and I think we'll talk about that in a minute. But also the prevalence is higher where people eat a lot more sesame, right?
Yeah.
What countries do we see it higher in?
So, for example, Israel, they have a tradition to have sesame really early on in the introduction to young children. And but they eat a lot of sesame containing foods, and especially like tahini and their and so on. And then you have also Australia, New Zealand. They also have a high prevalence. So some of the countries where you eat more,
I see.
They are exposed more, and then you have more high prevalence, basically.
So you mentioned that you worked for the Swedish Food Agency.
Yeah.
And in the U.S., that would be kind of the FDA equivalent.
Yeah.
There was recent legislation passed that enabled the FDA to increase their labeling oversight. Can you tell us a little bit about that?
Yeah, you think about the FASTER Act.
Right, exactly.
Yes. And they included sesame as the 9th major allergen on the U.S. list, which was done in a sort of faster path. I think they just had Biden sign it, and then it was a quicker way.
Kind of an executive kind of.
Yeah. So that was good, and they based it on like the latest evidence from other countries that have already sesame on their major allergen food list. And for example, Canada, Australia, New Zealand again, and EU had sesame, and that was based on evidence.
So they all have requirements that if it's in the food, it has to be on the label.
Yeah.
Yeah. And
so
that's
what
because
does it mean?
Right, exactly. So that's the reason for that is so people can avoid exposures, right? If they're known allergic.
Yeah, exactly.
So it's now 9 in the U.S. required allergens, and before it was 8, and we called that the Big 8, right? That was
exactly.
the majority of allergens that caused over 90% of food allergy.
Exactly.
So sesame makes that 9, which not a great thing to be expanding, right? But certainly the awareness of it is really going to help people keep themselves safe that do have a sesame allergy.
Yeah.
So I think what I'd like to do now is just quickly talk about the diagnostic process, right? Because we're talking about allergy. How do we diagnose allergy in general, specifically food allergy? And then we'll take a deeper dive into sesame. So the diagnosis of allergy really starts with a good history, right?
Yeah.
We need to understand how the patient, what patient's symptoms are, and how they're related to the suspected food. For instance, the time frame from when they ingested the food or were exposed to it to the time they had symptoms. It takes a little time to really tease out all those details and get a thorough history. But that's what clinicians should do when we're evaluating food allergy. And then we use a diagnostic test. Sometimes allergists use skin prick testing and serologic or blood testing. Primary care clinicians typically just use the serologic or blood testing. And that test, what that test does is provide additional information, right, to confirm or to help rule out a potential allergy. But they're not always, a test does not equate to an allergy, right? We have to combine the two, the history and the physical.
Yeah.
But sometimes, even with the test and the history and physical, it's still unclear.
Yeah.
And so maybe speak to us a little bit about allergen components and how they might add to that diagnosis.
Exactly. So that is sort of the latest development in the allergy diagnostic field, to have the allergen components. And what is that? That's basically, if you take the food, you have a lot of proteins in the food, and then you can separate them and sort of do the diagnosis for each and every protein. But you don't have components available for testing for all the proteins. But for example, for sesame, there has been no components available for testing. But we know that there is about 7. There are 7 on the list of sesame allergen components, but more are being discovered.
Sure, that have been identified.
Identify, exactly.
Mm-hmm. But specifically, there's one component that has been identified as being one of the big causes of people that are true sesame allergy have this component, right?
Yeah, they call it the major allergen in sesame, and that is SES-I1. So that's the major leap forward in the diagnostics of sesame allergy.
And that component was just recently cleared by the U.S. Food and Drug Administration. It's available in other countries as well, and it really it will help us to be more precise. So when we talk about an allergen component, right, we tend to use scientific terms.
Yeah, you're right.
So what is, when we say SES-I1, what does that mean, right? So it's actually the Latin name for sesame, for the genus and the species that we're talking about here of sesame. So
SES is the short for the Latin
exactly,
name.
and so it's Sesame indica,
Yeah.
right? And then the 1 is just the first allergen that was identified by researchers. So that's how we name allergen components. Not to go too deep, but the important thing is this is an additional diagnostic test that helps us be more precise and better predict someone's response if they're exposed to sesame. So will they have no symptoms or major symptoms? But let's go on to another, the last of the diagnostic tools before we move into sesame a little more specifically, and that's oral food challenges. So that's known as really kind of the gold standard of the ultimate in diagnosis, right? If we eat something and we have a reaction, we're allergic to it, right? But for the most part, we don't want to do that for everybody we suspect that. First of all, we just don't have the capabilities, right, in the healthcare system to do it. And also, we want to try to avoid having severe reactions, so we want to avoid high-risk ones.
Exactly.
But we want to do more of those low-risk ones, right? The ones that we think they're going to pass. And SES-I1 can help us with that, right?
Yeah, so SES-I1 is really good on identifying those at lower risk, because that will help guide the doctor. If I can do, for those with low levels of SES-I1, they have a lower risk for reaction, and then they dare to do the food challenge to be able to rule out, if not in every case, but many times it's a possibility to rule out.
It really helps to guide, right?
Helps to guide.
Yeah.
And also vice versa, if there is high levels of SES-I1, those patients may be more high-risk patients, and then you get guidance on, maybe I shouldn't do the food challenge right now, wait a year or a half year.
See what happens. Because people do outgrow their sesame allergy, right? How often does that happen?
So like 20 to 30% of the patients outgrow their...
So a majority of patients will not then outgrow once they have a true confirmed sesame allergy.
It's lifelong.
And that really brings us then to management. We know that anyone at risk for a severe reaction can have should have access to epinephrine autoinjectors and be trained in that. But also, what other steps can they take? And you being a nutritionist and dietitian by training, how can they help us really to deal with our allergies?
Yeah, so if you have a diagnosis of sesame allergy and you know for sure, then it's easier to do strict allergen avoidance and have the EpiPen, and that will guide the food challenges. But it's also very important to know. We talked a little bit about the symptoms, right? And you can have mild to severe symptoms, but severe symptoms it's often severe symptoms
and
related.
that's known as anaphylaxis.
Yeah,
right?
that's exactly, and that's important to know. And basically, if you compare to other tree nuts and seeds, it has been shown that sesame has the highest risk for severe reactions compared to tree nuts and other seeds. It's higher risk.
It's a dangerous allergen.
Yeah,
for
it's
sure.
dangerous, and they often coexist. So if you have tree nut allergies, and then you often have sesame allergy as well. So they coexist.
Exactly. We often see patients with multiple allergies, and the tree nuts, and of course sesame is a seed. So talk about kind of different forms of ingesting sesame and how people may or may not react as well.
Yeah, so there you can, if you, for example, seeds are really stable. They really have stable proteins because seeds needs to survive in environments and so on. So that is evolution have made them
hardy.
Exactly, really stable shells and stable proteins in them, and they also are stable through the whole. If you eat it, it's stable through the whole body, so to say. So you can actually have sesame seed not being digested.
It just goes flying through.
Exactly.
So they may not be exposed to a lot of sesame allergy by just eating a few seeds.
So
right?
seeds are less related to severe reactions, but if you ground it and you have it like tahini, is often used for food challenge because that is more related to the severe reaction. You have high concentration, and it's grounded, so that's so.
Yeah, and then we often hear about oils, and different oils I think have different potential to cause reactions.
Yeah.
Right. I think highly processed oils often don't have very much allergen in them, but yet I think when it comes to sesame, that's often processed with quite a bit of sesame allergen, right? So I think people do have
sesame oil is also something that it's really
people need to avoid.
Yeah.
And you know, I think that is really the take home too, that once we have a diagnosis of sesame allergy, it's important to get the right advice, you know, whether that be through through reputable websites, through nutritionists and dietitians, because it can be a hidden allergen as well.
Yeah.
And I think it's important to learn all the different terms for sesame, especially before it was required to be called out on the label, but also in homemade foods or restaurant prepared foods. It can, anyone who deals with food allergy knows that we have to be careful.
Yeah, and it's often called hidden allergen because it's difficult to see sometimes. It's not been on the major allergen lists, and then it's not on the ingredient list, so you don't know that it's there. And on the other side, the food producers, there is a risk for cross-contamination. Seeds are really often difficult.
Often around.
So hidden allergen, that's...
Gotcha. One thing I want to talk about before we start to wrap things up, it's been really informative, is about empowering patients. And I'm sure there are plenty of patients out there now that are wondering, I think I have, or I've had a previous diagnosis of a sesame or other food allergy, and I'm not quite sure. So how do I get to the bottom of it? And I think it's important that we empower people, empower patients, empower families, empower moms, right? to find what they need, to get with the right providers. And sometimes that's a specialist in food allergy, to make sure they get the correct diagnosis. The component that we talked about today, the SI1 sesame component, is now available through a national laboratory. It will continue to be more readily available throughout the United States. But not all providers know about it. Not all allergists will know about it.
No.
That's on us, right?
Exactly.
to try to make sure that everybody understands the value and uses it. But I would say, make sure you take, you really empower yourselves to get to the right diagnosis, and that may mean, shopping around a little bit to find the right person. Eva, thank you so much for joining us today. It's been really informative. I want to make sure everyone knows that there are resources out there like Allergy Insider, but also like your local allergists, that you can access regionally. I mean, we're here right now. There's probably 6,000 or 4,000 allergists, that will be coming to this meeting.
At the Congress,
and we're science is being created. There's poster presentations. There's abstracts being presented. Seminars.
Sessions on sesame, for example.
Exactly. So, we're very excited to be here and be interacting with some of the people that are really leading the field in allergy diagnosis. Do you have any closing remarks before we sign off?
Well, we can just summarize. It's becoming more common. It's a risk for severe action. It can be a hidden allergen. So I would say Sesame Allergy is something to look out for.
Absolutely. And it can
And
be
we
a bit
have
of a
better
challenging
diagnostic.
diagnosis.
Yeah.
And now we're moving even a step closer to
To-
better.
Yeah.
Yeah. Well, as always, thank you very much for tuning in. Thanks for all the hearts. Make sure you stay tuned for our next episode of Ask the Insider. If you don't already, follow us on Instagram, like our Facebook page, and make sure you use, Allergy Insider. It's really your go-to for medically backed information on all things allergy. Thanks so much. We'll see you next time.